Dear friends, good evening to all. I am Dr. Arun, Senior Consultant Gastroenterologist and Hepatologist, practicing myself mainly in Apollo Hospitals, Greens Road, Chennai, and also in Chandra Gastro Liver Clinic and Endoscopic Center. And today we are celebrating World Hepatitis Day. You should remember that 28th of July we are celebrating World Hepatitis Day. What do you mean by hepatitis? Any inflammatory activity which is going to happen in your liver, there is high possibility for you to land up in a complication called hepatitis. There are multiple etiological factors for you to develop this hepatitis. For example, you can develop any inflammation in your liver because of viral infections. There are so many viral infections are there. It could be because of any drug induced. There are so many other etiological factors are there for your hepatitis. But our predominant area to discuss about viral hepatitis. What do you mean by this viral hepatitis, which we are going to give so much of importance? As we all well remember that COVID is a scenario, and right now we are not being focused into that. But this viral hepatitis, which is going to exist, and it is going to cause so much of complications in everyday, day-to-day human's life. So what are the various complications you may develop because of this hepatitis? That you are supposed to remember that. 1. As we all remember, hepatitis A, B, C, D, E, there are multiple etiological factors for your viral hepatitis. Among these hepatitis A and E predominantly is going to spread by your fecal-oral route of transmission. What do you mean by fecal-oral route? If you are going to use a contaminated sanitation, so your sanitation, if it is not going to be good, if your hand hygiene, if it is not going to be good, if you are going to take frequent contaminated water, or if you are going to take unhygienic food particles, there is high possibility for you to land up in hepatitis A as well as E. But this hepatitis A is usually self-limiting. You may have fever, vomiting, loose stools, jaundice. Some patients, what do you mean by jaundice? Nothing but in case if you are going to land up with yellowishness of your eyes as well as high colored urine, yellowishness in your urine, you may develop jaundice. So this will be a transient phase. In case if you are going to land up with this kind of complication, usually it will be self-limiting. It will go on its own. For this, no need to do any major interventions. You need to just consult a gastroenterologist, and with minimal medications, usually the symptoms will improve. But regarding hepatitis E, there is high possibility in case if you are going to be a pregnant woman. For a females, it might be having evidence of fulminant hepatic failure. What do you mean by fulminant hepatic failure? Sudden onset of worsening of jaundice. You may have rapid worsening of jaundice. You may have high fever. Sometimes you may have comatose state. That's what's called encephalopathy. You may develop fluid in your tummy. What's called ascites. You may develop acute liver failure, and this may predispose to intensive care hospitalization. So you need to be very cautious in any pregnant woman who is going to develop this hepatitis E. They may land up with multiple presentation. But that's not the main area of interest. These are all the major etiological factors for acute hepatitis. There is certain entity called acute as well as chronic. What do you mean by chronic hepatitis? If your infection, if it is going to be there for a long time, for years, for months, but you might not be aware about that. Right from your congenital period, pediatric age group, and your adolescent age group, and in your adulthood, in your late adulthood, in your older population, you may have these dangerous viruses called hepatitis B as well as C. What is the most common modality for these dangerous viruses to spread? These two viruses, which is one of the most common triggering factor for all major infections which is happening in India. For example, there are 3 bloodborne viruses we are not supposed to forget. One very common, your retrovirus, your HIV. And your second etiological factor will be your hepatitis B as well as your hepatitis C. This hepatitis B and C, one of the dangerous viruses, because if it is going to be in your liver for a long time, in your body for a long time, there is high possibility for you to develop a condition what is called as liver cirrhosis. In case if you are going to land up with liver cirrhosis, it's nothing but a shrunken out state of your liver. In case if your liver gets shrunk out, what is going to happen? You are going to land up with a huge number of complications starting from your head to foot. You are not supposed to forget about that. And next to that, once a liver cirrhosis, if it is going to be there for a long time, you may develop a complication called liver cancer. It's nothing but hepatocellular carcinoma. This is one of the dangerous complications frequently been reported in India. Right now, even in the initial populations, sometimes if you're not going to get diagnosed with this hepatitis B and C, how this virus is going to get spread out? Frequent blood transfusion. In case if you are going to give, in case if you are undergoing frequent blood transfusion, there is high possibility. And frequent needle user. And if you are going to have a drug abuse, if you are using heroin or any other drugs, for example, if you are going to share the needles among your friends, there is high possibility for you to harbor this hepatitis B and C. And in case of dialysis, if you are going to be in dialysis for chronic kidney related problem, there is high possibility for you to develop. And in case if you are going to be multiple sexual partners, for male to male sexual partners or male to female multiple sexual partners, at that point of time you may develop, there is high possibility for you to land up with hepatitis B as well as C. So these are all the areas, and if you are going to use common razors and sharing the needles, all those things will precipitate. So you need to be cautious because these viruses are predominantly bloodborne. Even if the mother is going to have a virus at that point of time, if the mother is going to get pregnant, and there is high possibility for the baby to develop this hepatitis B. That's what is called as congenital onset of hepatitis B. So you need to be cautious, you need to screen the mother, you need to screen the baby, and after that you need to be in regular follow-up with the gastroenterologist to avoid any major complications. That's very, very important. Apart from that, how to prevent this? Once we are going to develop this hepatitis B and C, you are going to land up in a condition called cirrhosis. What are the various modalities for you to recognize your cirrhosis early? You may feel tiredness, fatigability, your blood count will go down. Usually the blood levels will be around 8, 9, 7, so your blood levels will go down. You may feel very tired, you cannot be able to concentrate in your work. You might be lethargic, you might be slow in your work. And apart from that, and once the cirrhosis is going to establish more, if you're going to enter into a phase what is called as a decompensated cirrhosis, at that point of time, there is high possibility for you to develop multiple complications. Once a patient is going to develop decompensated cirrhosis, there is worsening of events. It will be very difficult even for the best of gastroenterologists to tackle that. What are the various presentation of your decompensation? You may develop ascites. What do you mean by ascites? If you're going to develop large amount of fluid in your tummy, there might be a problem called ascites. It's very difficult because once you develop huge amount of fluid in your tummy, like a pregnant woman, what is going to happen? You cannot able to walk, you cannot able to run, you cannot able to climb up the stairs. You will be having breathing difficulty, so much of problem. Your fluid will migrate to your heart, your fluid may migrate to your lungs, your fluid may migrate to various other organs, creating multiple complications, and you may land up with liver failure. And what do you mean by liver failure? Your blood parameters, your coagulation. Which means, suppose in case if you are going to land up in any accidental cut, at that point of time, what is going to happen? The blood obviously is supposed to get clot. But if you have a liver failure, if your liver is not going to function in a proper way, so what is going to happen? Even if you are going to have an accidental cut, the blood clotting mechanism will not be functioning, and the blood loss is going to get continued. So why I would like to point out, this is what is called as coagulopathy. The coagulopathy, the worsening of events, the liver failure, your mind will not be functioning. You cannot able to remember your own address. You cannot able to identify your own fellow members. These are all the various complications you may develop, and finally you may land up in intensive care setup. And at that point of time, even the best of centers, even the best of gastroenterologists cannot able to save your life. So why I would like to point out this? You need to be cautious, you need to screen up early. There are so many modalities to diagnose this hepatitis B as well as C. So you need to screen this. There are so many molecules are there, good treatment modalities are there. For hepatitis B, if you are going to undergo, right from your basic vaccination, you can control this hepatitis B. Right from your pediatric age group, starting at the birth, during birth, at the time of birth, and at around 1 month of age, at around 6 months of age, there is a vaccination protocol is being followed even in the pediatric age group. We need to follow that. Even for the late adulthood phase, there are so much of vaccination being available for to control this hepatitis B. But once you develop this hepatitis B, you need to be in regular surveillance, regular follow-up with various other investigations to see whether you are landing up in any liver cirrhosis. So what are the various investigations? You can do your blood parameters, you can see your viral load, how much of virus you are having in your body. Apart from that, you may do your basic ultrasound, sometimes endoscopy, sometimes fibroscan. Based upon your presentation, the gastroenterologist may suggest you certain investigations to identify in what level your presentation is as of now. And this is the scenario which predominantly for hepatitis B. For hepatitis C, it's still more asymptomatic in the initial phase, but once you develop a complication, directly most of the patients will be landing up in cirrhosis and some patients will be landing up in liver cancer. So there is a treatment modality being available for hepatitis B as well as C. B, you need to treat lifelong. Usually the treatment duration is very prolonged. For hepatitis C, either you may need to take treatment for 3 months or 6 months. There are multiple line of drugs are being available. You should be well aware, even in multiple government centers as of now in India, there are various programs to provide these drugs at free of cost. So you need to be very sure, you need to screen up properly, identify your risk factors, control all the complications to prevent all the major events. How to prevent this? See, always you need to have safe and hygiene practices, and do not share your races with anybody, and do not go for multiple sexual partner relationship, and whenever you are going for dialysis and other things, if you are immunocompromised, if you have any other problem, be cautious for the dialysis unit in which you are going to use. And these are all the modalities. Always hygienic practice, avoid alcohol and control your obesity. If you are overweight, you need to control, because nowadays NAFLD is very common in India, which means a fatty liver related problem. You need to screen up that also, because if you are having hepatitis B, C, fatty liver, there are multiple etiology for you to develop this liver complication called cirrhosis. So you need to screen properly, control your weight, you need to control your obesity and screen up your fatty liver, and do not take alcohol at any point of time. Avoid smoking, avoid tobacco, and good hygienic practices and safe sexual practices. All those things you need to enhance properly to prevent all the major dreadful complications in order to make your liver to lead a healthy journey. If you want to make your liver in a healthy way, as the acute phase, in the chronic phase, you need to diagnose your problem properly. Once you are going to land up with liver cirrhosis, nowadays with the medical management you can try to improve, but once the medical management fails, you can promptly go for liver transplant. There are multiple centers being available right now for liver transplant. You can go at any point of time, but you need to decide whether you are going for deceased donor, which means you are going to take up a liver from a cadaver, or you are going to take up a liver from a living donor, which means any of your family members is going to donate up the liver. So that's not so bad. Why do you want to land up with such complications? The cost of this treatment will be around 20 to 40 lakhs, which is being prevailing in India. There are certain government centers, they are doing free of cost, but even then, so much of follow, long-term modalities of treatment, continuous management protocol, and you are going to end your routine life. Your social circumstances is going to be a trouble for you. Why do you want to create yourself in such problems? Screen yourself properly. Screen for B and C. And when you are going for blood donation, obviously you are going to screen up your liver and screen up your blood parameters for hepatitis B, C, as well as HIV. So screen up all those parameters properly, and as I counsel you, you need to take care of your diet, nutrition, obesity, metabolic parameters, control your BP, and control your sugar levels and all those pointers, and take care of all those things to prevent all the complication of your hepatitis B as well as C, to prevent cirrhosis, to prevent decompensation, to prevent liver failure. Pregnant women, be very cautious to overcome the presentation successfully and save your liver, protect the world. With this, I'm happy to rest my presentation. Thanking you all for patient listening.